Hi, in this video, I'm going to be talking about longer versus shorter duration of tamoxifen. Before I go on, I'd love to invite you to subscribe to our channel and check out our other videos on tamoxifen. We have a lot of them that might be helpful in understanding more about how it works, who should take it, and what to expect. This video will focus on what's the optimal duration of tamoxifen. How many years should you be on it? Just briefly, tamoxifen is a pill that's taken daily for a number of years. I'll get to that in a moment. In people who have estrogen receptor-positive breast cancer, it can also be used in preventing or reducing the risk of cancer. It can be used in pre- or postmenopausal women. It's effective in both. The duration of tamoxifen that you'll often hear us or other people talking about is 5 to 10 years. How did we come up with that? And why not longer and why not shorter? So in the research that's been done for tamoxifen, the early studies were compared to placebo. We had no idea if it worked, so people were randomly assigned to either a sugar pill, though it really wasn't sugar, or tamoxifen. And it was shown that tamoxifen reduced the risk of cancer coming back by half. Now, the benefit depends on how big is the risk of the cancer coming back. And you can watch other videos about understanding that, but in short, if you have a very high risk of the cancer coming back and it can cut it by half, that's a big benefit. If your risk of the cancer coming back is very low, even cutting it by half isn't going to be much benefit. I won't go into that much more, but you can drop us a comment or question below if you have a question. You can also go to yerbba.com to get your personalized Yerbba report, and you'll learn about whether tamoxifen might be offered to you, and this could be really helpful. Your Yerbba report, which is created using your primary medical records, different from your portal, will compile a list of all the treatment options you might hear about and be offered, including tamoxifen and including the pros and cons of tamoxifen in your case. So the early studies showed that yes, tamoxifen is beneficial compared to placebo, and it looked at tamoxifen for just a couple years. Well, knowing that breast cancer cells can lay dormant and can come back later, the next study was to look at 2 versus 5 years, and 5 years was clearly superior. So that became the gold standard, and that became the recommendation. As other drugs came out, the aromatase inhibitors were developed. Different studies were done comparing tamoxifen to the aromatase inhibitors, and then there also were sequencing trials. And what those were was both an aromatase inhibitor and tamoxifen, either one before the other or the other way around, and they've been found to be equivalent. You can start with tamoxifen and finish out your time with an aromatase inhibitor, or start out with an aromatase inhibitor and finish out with tamoxifen. But what about 5 versus 10 years of tamoxifen? The ATLAS trial, which was adjuvant tamoxifen, long against short, we come up with these very clever names, so it's the ATLAS trial. It actually was a worldwide study, and people who'd been on tamoxifen, whose cancer hadn't come back, who'd completed 5 years, were offered either to stay on tamoxifen for a total of 10 years or to stop at 5 years, and we didn't know which was better. So this was a randomized trial. When I say offered, I don't mean people got to choose. It was a randomized trial. What we found was that 10 years was better than 5 for especially people with higher risk of recurrence. The other thing that we know is that 10 years or even 5 years of exposure or use of tamoxifen is associated with better outcomes even 20 years after diagnosis. So it's quite remarkable, isn't it, that you can take a drug for 5 years and that your risk of recurrence at 20 years will be lower than if you didn't take it. You're not still on it, you've stopped it. Same at 10 years. If you take tamoxifen for 10 years and then stop it, and I'll explain in a moment why you should, your outcome is better 20 years after diagnosis. So these drugs have amazing effects. Yes, they don't necessarily kill the cancer cells, they keep them dormant, but when cells are dormant, they're kind of like sharks. If they're not moving, they die. So we continue to see benefit of tamoxifen even after you stop it. Now, it is often the case now we don't keep people on for 10 years, rather we split that difference. We split up the treatment with an aromatase inhibitor, but as you know, some people cannot tolerate an aromatase inhibitor. They don't feel good on it, or they have other problems. You can watch our other videos about the aromatase inhibitors. And somebody at higher risk, let's say stage 3 breast cancer, 10 years of tamoxifen is an excellent option. I am not trivializing the side effects of tamoxifen. We've covered those in other videos. I just want to explain what, in response to comments and questions you all have had, is, that staying on this drug longer than 10 years will not give you additional benefit. Rather, that benefit of the time you put in continues. The downside of staying on tamoxifen long-term is that as we get older, we become at higher risk for the rare but serious side effects of tamoxifen, and those are blood clots, which increase in risk as we get older. Every year I get older, I'm at higher risk of developing a blood clot, and I'm at higher risk of developing cancer of the uterus, also called endometrial cancer. And in the absence of additional benefit, why would I do that to my body? Now, if you've gotten good cholesterol and good blood pressure and good bone health from your tamoxifen, I understand why you wouldn't want to come off of it at 10 years, but there are other options for all of those other conditions. I hope this has been helpful. I've covered a lot. If you want to learn more about whether tamoxifen might be part of your treatment plan, I would love to invite you to go to yerbba.com to get your personalized report. As always, you can join the conversation by putting in a comment or a question below. We read every comment. I read every comment and get back to you just as soon as we can. We'd like to remind you that the people reading the comments are people. We're actually real people, so please be kind and dignified in your comments. Thanks as always for watching, and we'll see you